We're here today with John Bernot, President and Chief Medical Officer of Bravado Health. So, John, thank you for taking some time. And as someone who started in health IT and then went to medical school, tell me a little bit about what you do at Bravado Health.
Sure. Well, thanks for having me, first of all. So, as you mentioned, I started off actually as a mainframe programmer and spent most of the early part of my career doing health IT work, and ended up specifically at the Maryland Hospital Association, where I was working on health quality measurement software. Over time, we grew that project up over and over again and got it bigger and larger, and that became a bigger part of healthcare, is the quality measurement part. At some point, though, I realized that I had still wanted to go to medical school. It's actually what I went to undergraduate for in the first place. It wasn't the right time for me, so I made the jump back into medical school, went to medical school, did my residency in family medicine. I still practice family medicine today, just part-time though at this point. So at Bravado, though, I had the opportunity to all this quality measurement that I brought up, all the stuff that I see for my patients, I actually am able to build a software that will facilitate it for the first time. So at Bravado, I'm the Chief Medical Officer, so looking over the clinical integrity of the system, making sure we're interfacing and we're after the right challenges in healthcare. And then on the President's side, it's really an integrator role across the department.
So who does Bravado serve? Who is your customer?
Yeah. So our customers right now are providers. That can be provider single practice, a single physician at a practice. It can be large groups or systems. But the provider is really our customer under the current market that we have. Yeah.
Okay. What unique problem is it that Bravado is solving?
What happens to the patient when they're outside of the walls of the facilities, at the clinic, whether that is the doctor's office, whether that be the emergency room, the hospital? What happens to those patients? So what the unique thing that we're doing is reaching out outside of the walls with care plans, very tailored down to the physician, what I want, and to the patient based on their own comorbidities and conditions. So there's some smartness, some intelligence to the plan that we're providing to that person. And so I can ask those 2 or 3 questions. Did you get your medication? Have you been able to take it? And how are you feeling? And I'm able to actually do better care because I'm able to know who I need to give that extra care to. So one of the things that's been the biggest challenge, I think, is not the idea of doing this, but it's the actual getting the engagement rates going up. We've invested heavily into that experience. And specifically on that, what we're doing, the experience is we do SMS to mobile web. The SMS, everybody gets an SMS. They're very high read rate. Click on it and it takes them into the secure mobile web. So we get the best of both worlds. We've to date avoided any app downloads. They drop engagement rates off the cliff. So the experience then would be, once you're enrolled in that, and you don't have to take any effort, we integrate to the EHR, realize you're a type 1 diabetic and your provider wants that plan activated, and then you'd start getting messages that would be tailored to how that clinician, physician or physician's assistant or nurse practitioner wants to treat your type 1 diabetes. And it may just be a weekly check-in. Have you had any lows? Have you had any highs? If they're normal, we pat them on the back and say, everything's on track, we'll check in with you next week.
When it's closing the loop, based on their responses, are those responses going back into the EHRs or going into your platform?
The current process, it goes back to our platform in the discrete data elements.
Okay.
So typically it's not the physicians who are looking at the data in our platform as much as a case manager or a nurse navigator, but then the aggregate goes back into the EHR. So the clinician can then see it through their EHR without having to figure out what's the login to our system. They may never even ever see all the dashboards and alert systems that are going on in ours if it's being handled by somebody else within their practice.
What about healthcare data has been a challenge for you as you've been building out this program? What's been hard?
Well, I was telling somebody earlier today, I said I could literally make a full-time job of just interpreting between engineers and clinicians. There's such a huge divide, even in manufacturing, like you said. We understand what an assembly line is, we understand what a payment remittance is, but you don't understand what's an encounter. We don't understand what is a medication or a lab code, what are all these ICD-10s, what does this stuff mean? So I actually found the healthcare data is by far the most complicated that I've worked with. There's no anchor to your regular life as to what these things are. So really I think the difficulty is the clinicians have a very difficult time speaking to an engineer and asking for the right thing, and the engineers have a very difficult time understanding the requirements. We knew we had to go EHR agnostic, and if we can't connect to it, we're going to learn to connect to it. So that was the first thing we did to try to get over this fragmentation. One of the things that I think is a little bit unique in our model is patient engagement, when it comes down to that, there's the software, and there's only so much you can do on the software. We really believe that the engagement comes from the whole process. Having that physician or clinician prescribe this tool and say, this is how I'm going to care for you, this is how I work for you. There's significant data to say that if a physician recommends you use an app versus an app store or some commercial, it's not even close. It's 3% to 70% or something along those lines. So getting the clinicians involved, directing them, helping them, coach them through the process, giving them the collateral that they need, and then having that follow-up loop on the backside. We also realize we have to go beyond the software to get the engagement rates that we want, to alleviate this confusion and really still have that human touch. If we don't have the human touch, I think we're not going to keep the patients engaged.
So before Bravado and after Bravado, like, what is it that they're saying about their experience?
The thing that I like the best is, and which is where I really believe our niche is that new frontier of data. They now have insight into data. It's not even captured in the EHR. We don't know what you do at home. We don't know if you take your medicine at home. We don't know how you're feeling 3 days out. We don't have any vehicle to do that. So they opened up a brand new frontier of data, and it's the data outside of the walls, which honestly someday will probably dwarf the EHR data that is within the walls, because that's where we spend 99% of our time. We don't spend our time in the doctor's office or in the hospital. We spend it at home fending for ourselves and loved ones, and advocates are helping out with this care. So we really have focused on saying that. I think that's the song that we hear and want to hear, continue to hear from our customers, that this brand new frontier of insight into data, what's going on. Never had any idea what's happening at home.
What is the future of the data that lives outside of the EHR? What do you see coming around the corner?
When the industry says, wow, you're using a remote patient monitoring platform that's really looking at the care of the patients, that's specific to the patients, and we'll take in all of those data feeds that you mentioned, because all of our activities could vary. If we set up a trigger to say that if the person had 10,000 steps, don't ask them if they've exercised today. I want us to be the RPM device, not the RPM device that feeds into our platform to be considered the RPM device. We're really excited about the future. I mean, I think that, as I said, this is a frontier that you can't say how was it done in the past, because nobody has the data. So getting an insight into that first, and then we're going to be able to make so many better clinical decisions with that data, and just continue to expand the amount of inputs into that data over time. So we're really excited about it.